If your back still hurts every time you work out postpartum, it's probably not your workouts. It's something that almost every mom is missing. And it's the first thing I check. Because if this isn't in place, no amount of core work will fix your back pain. So during pregnancy, a few key things change. We have 4 parts to our inner core: the breathing diaphragm, the pelvic floor, your transverse abdominis, and your little back muscles called the multifidi. And during pregnancy, a few things start to shift. The first is our posture. And for most women, we start to change where our rib cage and pelvis are to make room for our growing baby belly. That postural change changes how our diaphragm connects with the rest of the core and how our core functions in general. So fast forward to postpartum. We had 9 months to get our body used to that shift in posture. So our inner ear and brain think that that shift is natural and that it should be there. But early postpartum, the demands on our body are huge. We have to soothe our newborn constantly. And typically when we soothe them, the weight of them keeps us into this postural shift. And so our brain says, yes, that's correct. That's neutral to your brain. And then fast forward to when we're trying to work out, we start to work out in that shifted posture. And we know that our core functions best when our posture is aligned. And that disconnect from pregnancy is keeping our core from actually firing properly. Here are the first few things that I see with moms when they're trying to work out. Okay, so the first is that we're slumped backwards and we're tucked under, right? So think about, as we're trying to squat and move, it doesn't allow our glutes to fire, and it almost becomes a chute of pressure down into our core. We usually end up gripping our upper abs, which doesn't allow our pelvic floor and lower abdominals to fire well, which makes compensations in our body. Now, the next I see is that we are flared in our trunk, right? Think of a pregnant baby or pregnant belly, right? We end up flaring to make room. And so when we're in this position, our diaphragm just can't connect with our core. So if we're trying to do core-related movements, rotations, pulses, and we're anteriorly tilted and our rib cage is up, that core can't connect. And we're gonna start to compensate in different ways, which make our back pain worse. So the first thing that we need to fix is stacking your rib cage over your pelvis. So when we're thinking about this flared position, we want to think about, can we bring ourselves into neutral, stacked? We're gonna have a better diaphragmatic breath and better activation into that core versus when we're here. Most women have an upper chest breath, and we tend to not get activation here in our core. And if we're into this slouch posture, we end up shooting pressure down into here because of the tension in our upper abs. So we need to pull ourselves into a position that stacks our rib cage over our pelvis to allow us to access that core so that our low back does not have to compensate during our workouts. And when we think about this posture in daily life, not just in our workouts, we can tell if we are in these postures all day long soothing a baby, how much pressure that's going to put on our low back. And if we can stack ourselves, right? If we can lift in a stacked posture, that is going to make our core strategy more efficient all day long and during your workouts, which is going to start to heal your core strategy. Once your rib cage and pelvis are stacked, your core can finally start to work together again. But here's the problem. Most postpartum women are still making a few key mistakes that keep their back pain coming back. In the next video over here on the left, I'm going to walk you through the most common mistakes I see postpartum women making when they try to fix their back pain.